Hello, I'm Sam Glassenberg, CEO and founder of LevelX. We use video game technology and video game design to accelerate the development of new skills in medicine and accelerate the adoption curve of new treatments and new therapeutics. Exactly. So we're making video games for doctors. So imagine almost 1 million medical professionals on their phones playing games where you can download an app and you can literally play through dozens of the rarest, most difficult cases in your specialty and earn CME while doing it. So basically what we're doing is we have cases that have been submitted by leading physicians across the country. Some of the most difficult diagnostic, treatment, procedural cases. You can pick up your phone, try your hand at it, try different approaches, try ordering tests in a different sequence, try treating the patient in a different order with a different dosage, with a different treatment paradigm. You can do a procedure using different devices, and throughout you're just learning different techniques, developing mental models for these complex systems. And it's these mental models that differentiate the experts and the novices. And so what we're able to do is we're able to close that gap by capturing the experience and knowledge of experts and then creating specific game levels and game mechanics that help you train your brain to develop those mental models that you otherwise would only develop through practice on live patients. All sorts of skills. So some of the skills, the obvious application is the procedures, right? Interventional cardiology. Where do I navigate my guide wire and which devices, which stents do I place in which configuration and what size at what location and what sequence? These are procedural skills, but a lot of what we do is purely clinical. A patient presents, how do you diagnose a patient that might have a rare disease? That, when we think about that, that's a puzzle game. Right, that's a reductive reasoning puzzle. When we think about longitudinal management of a difficult patient with multiple comorbidities, when we think about it in video game terms, that's a strategy game. And so what we do is we capture these cases, not just with multiple choice tests, but where you're actually ordering tests, dosing, diagnosing, treating, and you're actually making a sequence of clinical decisions and then understanding the consequences of those decisions, developing mental models in your brain. So when you come into the game, you register as a physician, you put in you can just search for yourself in the NPI database. And then when you complete CME content, we will send you a certificate for the CME credit. So these are the only games that offer AMA Category 1 CME credit from literally doing surgery or diagnosing virtual patients. So as opposed to just watching a video or a lecture and completing a multiple choice test, these games are actually measuring cognitive skill, deductive reasoning skill, surgical decision-making skill. And we're able to actually capture that and measure that as part of a CME game. Yeah, exactly. Excellent question. So this company I can even sort of tell you how LevelX got founded, because we've been doing efficacy studies on our work even before LevelX began. So I've spent my career in the video games industry. Had a successful career making games for Hollywood, for Star Wars, and all of this has basically made me the disgrace of my family because I come from a long line of doctors. My grandfather was a famous doctor, both my parents, my wife. I'm the idiot who never went to medical school. And so in 2012, my father, who's an anesthesiologist here at Northwestern, gave up and he said, all right, Sam, you're too old to go to medical school. Put all this gaming nonsense to good use. Make me a game to train my colleagues to do a fiber optic intubation. It's a tricky procedure. We only do it on difficult patients. So just make me a game they can play on their phones. I don't want to have to drag anyone to the training center. So I sat down for 3 weekends because I was busy running a Hollywood game studio. So I sit down for 3 weekends out of guilt and I throw together a terrible little game for my father that I uploaded to the App Store. And I handed him the link and didn't think about it again. 2 years later, he calls me. Hey, Sam, how many people downloaded it? Dad, I don't know how many of your friends downloaded your game. I'll check for you. I went and I looked. We had 100,000 doctors, nurses, and airway specialists who'd been playing. So I Google it, why did this happen? And I discover, unbeknownst to me, they've been doing efficacy studies at medical schools all over the world showing this crappy game I made for my father is drastically improving physician performance. That was the motivation for starting the company. Since then, with every app we've produced, we've been working with our clinicians to structure efficacy studies to actually measure that it improves performance. And what we're able to see, not only does your performance improve in the game, but we can actually see how that performance translates to clinical behavior. And we're measuring it not only on medical students, but we're actually also measuring it on practicing doctors. And what we've actually seen is, we've done studies where the average participant has been in practice for 14 years, and we're able to actually measure that we're able to improve performance on doctors who are seeing hundreds of patients a week. And so I think what's exciting about this is it's not only useful for the obvious case, which is medical students and residents, but we're able to continually improve performance of practicing physicians. And as new guidelines are released, like for example, the recent GDMT guidelines, we're able to build game content that disseminates those guidelines in the most effective way. So instead of just trying to look at a flow chart of guidelines and try to memorize it, here we let you play through it, where you can literally just play through dozens of patient cases and develop mental models of what are the actual consequences of making different clinical decisions. And what this does is it helps you remember these guidelines in a far more effective way. So instead of taking years or sometimes decades for guidelines to actually change the way that medicine is practiced, we can accelerate the dissemination of those best practices. Exactly. So this is where our work with the American, with the AHA has been so instrumental, because what we've been able to do is you have the understanding of what are the needles that need to move, what are the educational gaps, what differentiates an expert versus an average, and what are those gaps and what needs to be closed, and then we come in with a toolbox to help do that. And we've already done that in things like CPR training, which is a little bit more mass market, and we're continuing to do that in terms of changing the way that cardiologists treat a wide range of conditions and diagnose a wide range of conditions. So through our partnership, what we're able to do is we can bring the technology to bear, but the AHA brings the experience and the knowledge of where those gaps exist, and also who are the experts in the field who can contribute the cases, and can not only contribute the cases but also peer review any content that we create to make sure that it's not only clinically accurate, but that it also closes those educational gaps. And then we work together on efficacy studies to demonstrate that it's really moving the needles we want to move.